Feeling nauseous or vomiting is a common thing in pregnancy, but if these symptoms happen too often, or they're more severe than what we'd expect, or also appear in combination with other symptoms, then there might be an underlying cause for these symptoms. These other symptoms that might indicate that there is some underlying condition or an issue are feeling tired, thirsty, and frequent urination. Some diseases appear only in pregnancy, and so it is the case with this disease I would like to talk about. But what causes it, and where does it take place? This, which you can see here, is the pancreas, an organ of the human body responsible for various functions. Besides producing insulin and other hormones, it also produces a fluid that contains digestive enzymes, and they are released into the duodenum of the gastrointestinal tract. The pancreas, as we said, produces insulin, and insulin is a hormone that helps get the glucose from the bloodstream in the arteries into the important vital organs of the body, such as the heart over here. It also supplies other organs, such as muscles, with the glucose they need to function properly. If, however, the body becomes resistant to insulin that is produced, the amount of insulin that is normally produced will not be enough to supply the organs with the sugar they need. Normally, we can describe this phenomenon in a condition called diabetes mellitus type 2. But before I explain why this is important for pregnant women as well, I'd like to ask you to do something for us. You see, YouTube and other websites will only suggest our videos to pregnant women if you like this video and subscribe to our channel. That's just how their algorithms work. And there are many pregnant women out there who should be informed about this condition. But now, back to the insulin and pancreas. There is another form of diabetes mellitus, and that is gestational diabetes. It is a form of diabetes which appears only in pregnancy, and it poses a direct threat not only to the health of the child, but also to the health of the carrying mother. A simple blood glucose test might reveal pathological changes, but it is really important to when and exactly in what state this glucose was measured. Reference values for glucose can be different depending on whether this person was tested in a fasting state or right after having a meal or 1 or 2 hours after a meal. And besides measuring glucose levels, other diagnostics might be needed as well. These include measuring body weight and additional lab results. Up to 10% of pregnancies in the United States are affected by gestational diabetes. It means that every 10th pregnant woman might be affected, and these numbers are actually not low, they're high. It is extremely important to get these diagnostics done properly because simply measuring glucose once is not enough. There are specific values, lab results that have to be analyzed, and glucose levels after a set of hours after a meal, and a well-defined glucose level in a fasting state. If a single measured value is above the limit, gestational diabetes can be officially diagnosed. That's why the measurement should not be done only once and too quickly considered as normal. Nothing is more secure than the mother's uterus. This fine separation of mother's and child's blood prevents transmission of diseases. Mother's abdominal fat protects the child from the outside world, mechanical and thermal possible dangers. And yet, not willingly, the mother's pancreas might be producing too much insulin because her body became resistant to the insulin it produces. A newborn child might have problems with breathing, but also because it was exposed to too much glucose in the pregnancy, the pancreas of the child after the birth might be producing too much insulin because it was simply used to that during the pregnancy. This might result in sugar levels dropping way below the reference values. Medically, this is defined as hypoglycemia. Child's body might experience a condition called macrosomia. Macrosomia is a condition in which a newborn has an increased birth weight. In this case, this would be just another consequence of an increased sugar level during the pregnancy. And all that sugar would normally be taken in by the muscles and the fat tissue of the child. Ultimately, a pregnancy with gestational diabetes might end in a miscarriage, but besides these immediate consequences, some long-term consequences for the pregnant mother exist as well. For example, many women suffering from gestational diabetes also develop type 2 diabetes later in their life after the pregnancy. Doctors and patients, we have something for you. If you're a doctor and you want to make videos like these, then go to Symptomsky.com. But if you have more questions about diabetes, then go to Symptomsky.com/help/diabetes.